Hi everyone, I'm Rosie and welcome to Vox Yoga. Today's video is all about acid reflux and how it could affect the voice. So I'm going to give you a little bit more information about what acid reflux actually is, causes, symptoms, diagnosis, treatment and prevention. I'm then going to give you a little bit more information about my experience of acid reflux as a singer. So I'll start off by saying that I am not a doctor. However, I am a professional voice user that has suffered from acid reflux, and unfortunately it has had a bit of an effect on my voice. So I've been through all of the hospital treatments, diagnosis that I'm going to talk about, and I've tried pretty much all of the medication and care tips as well. So I hope that you feel you might be in good hands with this video. So let's get started at the beginning. What is acid reflux? So acid reflux is when the stomach acid flows back up out of the stomach and comes up the esophagus. It happens when the lower esophageal sphincter is slightly weakened. We want this to be closed most of the time, but if it relaxes and opens, this can cause the acid to come back up. So everyone suffers from a bit of heartburn and indigestion every now and then. However, if it is becoming a little more chronic, you're noticing more symptoms and it's happening maybe 3 or more times a week, then you may be diagnosed with GERD, gastroesophageal reflux disease, or GERD. However, there is another type of reflux as well, and this is laryngopharyngeal reflux, LPR, or also known as silent reflux. This is when the acid comes up the esophagus, but it almost keeps going and spills into the area of the pharynx, the throat, and the larynx. So you can see how this could be really detrimental for singers. It's known sometimes as silent reflux because we don't always get that heartburn, bloated indigestion. We don't often get that many symptoms at all with it. So let's talk a little bit about the symptoms of both of these types of reflux. So GERD, GERD, gastroesophageal, this is when it stays kind of up to just below the throat, I suppose. Certain symptoms: heartburn, you feel a burning in the chest area, sometimes goes through to the back. You might find you are a little bit bloated, particularly after eating. Maybe that sensation to clear the throat a little bit, or a bit of a cough. Maybe difficulty swallowing sometimes as well. This one also symptoms can be exacerbated at night. So you often might find that in the morning you're waking up and feeling like you've got that lump in the throat, or yes, that burning sensation as well. So laryngopharyngeal reflux, LPR, you may find you have some of the symptoms of GERD as well. However, it's more likely to show itself in symptoms in the throat. Maybe slight voice loss, a little bit of hoarseness, that feeling again of wanting to cough, clear the throat. You might have some irritation in the larynx. We're also likely to experience more postnasal drip, that feeling of mucus at the back of the throat. And this apparently is because it's something that wants to put that fire out of the acid. Again, you might have that lump in the throat feeling as well. And also having quite a dry mouth is a symptom of LPR. As I said, often silent reflux, we don't have these symptoms. So it may be that if you're having voice problems and you do then go to the ENT, you might find out that you have reflux and you didn't know about it at all. So diagnosis: if you are having voice problems, how do you find out if it is reflux? And if you suspect it might be reflux, what kind of reflux it is? So if you are a voice user, first of all, you will go to the ENT. You'll get referred there from your GP to the ear, nose and throat doctor. There they will do one of 2 tests, or maybe both, as they'll want to look at the vocal cords, the pharynx and the larynx. So the first is a rigid stroboscopy, and I'll tell you a little bit more about my experience with these tests later, but the rigid one goes over the tongue and shines a light down the back of the throat to look at the vocal cords. The second one is flexible, a nasal endoscopy, sometimes known as a laryngoscopy as well. This one is more flexible and it goes up the nose, and then you swallow a little bit at the back, and then it sits and hovers just above the vocal cords. I think the rigid one gives a bit of a better picture. However, with the flexible one, you're able to do things like speak and sing a lot more easily with it in and get a good picture of the larynx and the vocal cords at work. So if at the ENT they see this redness and they can see that there's evidence of reflux, you'll then get referred to gastroenterology to diagnose it further and check that there aren't any complications. So at gastro, again, there's a few tests you might have, but there are three main ones. I've had all of them. So the first one is an endoscopy. So this is when they put a tube with a camera into the mouth and it goes into the stomach and has a look at the acid and everything in the esophagus on the way as well. The next one is a barium swallow. This is when you swallow some chalky liquid and you are then x-rayed and they get to see this liquid and how it shows up in your system inside the body. And then the last test is a pH test. So this one goes up the nose and then it hovers just above the lower esophageal sphincter. And you wear it for 24 hours. You eat as normal, you go about your routine as normal, and you wear a little pack on the body. And anytime you experience symptoms, you press a button and it then once you've finished, it goes onto the screen into the computer and they can look at your symptoms over the 24 hours in the hospital. So after you've had maybe one or all of these tests, hopefully your gastro doctor can give you a little bit more of an idea about what's going on and then know what course of treatment to take with you. And as I said, to see if there are any complications as well. So that leads me on to treatment. So let's start with some things that actually aren't medication. So diet is going to be the first thing, and I stress this when I say that it is different for everyone. There's a lot of things that will say, you know, avoid tomatoes, peppers, alcohol, caffeine, particularly acidic foods. Yes, of course, that might be what you need to do, but it's not the same for everyone. So it's really good to start keeping a food diary or noticing when your symptoms are worse, if you've got any trigger foods. It's often advised as well that you maybe eat smaller portions of food throughout the day rather than just loading up on 2 or 3 massive meals. Again, this will help avoid the bloating and certain indigestion symptoms. Eating late at night is often a big trigger as well, which I know sometimes with performers, singers, that's just not doable sometimes. However, if you know you have to eat late at night, maybe pacing your meals throughout the day a bit more or thinking about the type of food that you are going to eat at night. It's been shown that keeping healthy, keeping at a good body weight, doing lots of physical exercise is really good prevention as well. And also keeping stress levels down. Stress is something that can really flare up digestion issues. I talk on this channel about how everything's connected. Our vagus nerve goes all the way down through our voice, past our hearts to our stomach. So if you lower your stress, I know easier said than done, then it may be that your reflux symptoms do start to lower as well. Often reflux symptoms are worse at night, so raising the bed is also really effective. I think they say about 4 to 6 inches is best, maybe just putting some paperback books under your bed head or some bricks, or you can buy a wedge pillow. Of course, this just means that your throat is higher than your stomach, so it's harder for the acid to come up. It's also come out lately as well in studies that if you sleep on your left-hand side, because of the layout of the stomach and where the esophagus is, it's less easy for the acid to come back up. So you might as well give it a go. If you have got LPR and you're finding irritation in the throat, then going for all those usual voice care tips. Voice rest, if you know that maybe you're feeling a bit more hoarse, your vocal cords are inflamed. Staying hydrated, trying to keep the area as moist as possible. Using steam, using a nebulizer will just help to keep you in the best vocal health. And of course, doing lots of warm-ups if you need to, cool downs, SOVT exercises are going to be really useful if your larynx is inflamed. So let's talk about medication now. It may be that your doctor prescribes you with proton pump inhibitors, and this is where you take tablets, maybe 1 a day, 2 a day, different dosages, of course, depending on your symptoms. And this changes the acid from within the stomach. And then Gaviscon. I'm sure if you got to this video, you have heard of Gaviscon. So again, taking it in liquid form, and this forms a seal over the top of the acid that stops it from coming up. So I recently found out that Gaviscon Advanced is actually the only type that is I suppose validated, is that the word, to actually treat gastroesophageal reflux disease. So I'm going to put a link to a really interesting, I think it's interesting, reel on Instagram where VoiceFit UK talks about this study and why it's something to do with the alginate, the algae that goes into the medicine. So don't just instantly go and buy the cheap own brand version. In terms of medication, proton pump inhibitors, PPIs, please do what your doctor said. Please, please, please go, take the medication if you think that's the best course for you and you agree that with your doctor. However, there was a recent study published by the British Medical Journal where they gave one group lansoprazole and the other group a placebo effect. And it actually showed that there wasn't much difference between the groups that took the PPIs. You might also be prescribed omeprazole, esomeprazole. They're all from the same group. I'll talk a little bit more in the second part of this video about my experience with medication, but if you want to check out that article, I will link it below. In terms of prevention, it's really similar to the treatment. Things like diet, just thinking if you think you might be starting to suffer from reflux, look at your diet, thinking about eating little and often instead. Sleeping position, trying to keep as physically active as possible. So I hope that's given you a bit of more insight about acid reflux, and it kind of gives you an idea about why that could really affect the voice and potentially cause problems for singers. So now I'm going to talk a little more about my experience as a vocalist with reflux, as unfortunately it did contribute to my vocal injury. I did develop nodules. There were other factors as well, so don't panic. But again, I did have lots of hospital tests. If you want to find out more about my vocal injury, I will pop a link to the video above. So let's start talking a little bit more about these tests and how it might feel to have them. As I said, I've had all of those 5 tests that I mentioned. So when I was having voice problems and I suspected it could be reflux, I went to the ENT first of all. So the rigid stroboscopy, this is the stick that goes to look at the back of the throat. Yes, it's a little bit uncomfortable, but it's over quite quickly. Just remember to breathe. That's the biggest tip I can give with every single one of these tests. The nasal endoscopy, the flexible one, is quite cool once it's in there and you don't really feel it that much. You can sing with it in there. Of course, it's just that initial stage when you have to get it over at the back, with a bit of a swallow. Just again, breathe through it. Trust that your ENT or SLT knows what they're doing. It's not going to keep going. It will stop before it gets to your vocal cords. It might feel a bit uncomfortable. You can ask for a little bit of spray to numb the nose area if that might feel better for you. And if your doctor's happy with everything on the screen, it may be that they show you your vocal cords and larynx on the screen as well, which I think is pretty cool. So everyone's going to experience these differently, but remember to breathe, trust your doctor, and I'm sure it'll all be fine. So then on to gastro. The endoscopy, I'm not going to lie, I didn't enjoy the experience of having an endoscopy. I found it I quite panicked a lot. However, I'd do it again if I had to have the test to keep my body and my voice healthy. It's not comfortable when it goes down the back. It's going into your stomach. Again, I would really just advise to breathe, but also to really talk through the process with your doctor or whoever's doing it. I think I panicked because it just suddenly started happening and they hadn't kind of talked me through it. I'd asked for sedative. I got an injection in my arm, and then a second later they put the tube down my mouth, and I of course thought that I'd be lying there for 10 minutes before they did it. So talk through the process. Sedation is an option. Not everyone has it. I was lucky my endoscopy only lasted about 5 minutes. They can last longer. So talk to your doctor is the main advice I would give for that one. Barium swallow with the chalk substance, that was absolutely fine, really. Yeah, not very pleasant drinking a cup of chalk. They just say the symptoms with that is that you might get a bit constipated for 24 hours, but you just eat some fibre and you'll be fine. And then the last one is the pH test. So this is a bit, it's a bit of a strange experience. You have a tube up your nose, which is taped to your face, and that then leads down to this pack that you wear across the body. As I said, anytime you have a symptom, you press a button. So even in the night, and it's quite hard to sleep with this in, I can't remember what the symptoms are, swallowing, a feeling of, actually I think you talk through with them to add some of your symptoms as well, you can. So it might be, swallowing, heartburn, burping, that is often a symptom of reflux as well, so you just press the button. My main takeaway for this one is please make sure that whoever does this test or whatever hospital does it knows how to interpret the results, because I went through 24 hours of that test. I missed a friend's birthday. I got the tube in London to and from a hospital with this, tube. Got the tube train with a tube in my stomach. And the doctor at the end said, oh, actually, I'm not very good at interpreting these results. And that was that. I didn't get anything out of it. So I really advise, again, talk to your doctor, make sure you understand the process. So from the first part of this video, you can see as a singer, if you've got this acid coming up, irritating the throat, it could lead to inflammation in the vocal cords. That means that they're not going to be able to vibrate quick enough, work efficiently. If they're swollen, you're having to put in extra energy, force and drive. So please, if you get diagnosed with LPR, of course, you'll get given a treatment plan. But if you suspect you might be, I really advise being careful about your voice care routine, taking voice rest as much as possible. As I said, there were other factors to my vocal injury, but I often would sing through it, and I caused so much irritation that I developed vocal nodules. My main symptom actually is postnasal drip, and that's where you feel the mucus at the back of the throat. So often if you need to clear it, you have to cough, your vocal cords are whacking together, or you have to swallow quite a big lump of slightly fiery mucus, which I'll be honest, it doesn't then feel very nice for the next 30 minutes afterwards. But we have routines we have to keep to. Often that will be in the middle of a voice use day. So just having things like Rennies, a kind of temporary relief, or Gaviscon to hand is just so useful. I know I like food, I like beverages of many kind, but if there's something that triggers you and you have a heavy voice load, just try and cut out that trigger food and find what you need. I know eating late at night is a disaster for me in reflux, so Gaviscon, make sure you take it. This is not an advert for it, but it's advised by doctors, and I think it really does work. And then in terms of medication, as I said before, just speak to your doctor. I personally found that medication, taking the PPIs, didn't really do much for me, actually made my symptoms a little bit worse, but they obviously work for some people because many people are taking them. So again, do what your doctor says, but just be mindful about your course of treatment and make sure that it is really right for you. Then I think that stress is probably one of the biggest things as singers, because we know what's going on. We know that there's something in our body that's irritating our voice, and that makes us get more anxious. It makes us get stressed. We then maybe get tense, and that tension may again have another effect on the voice as well. So I do think if you are a singer or a voice user that is suffering from reflux, one of the main things is to try as much as possible to cut down on the stress. I know that I got very anxious when I got diagnosed with nodules, and actually after my diagnosis my voice got much worse than before when I had nodules, because I was suddenly freaking out about all these things I'd been told. Oh, you've got to take this medication. I think I left the gastroenterologist with like 4 medications to take multiple times a day. And mine wasn't even that bad. So I understand it's stressful. So anything that you find lowers your stress level, going for a run, getting fresh air, doing some yoga, then really do try and have self-care, maybe some mindfulness, just to know that actually doing that is shown that it can reduce the symptoms of reflux. It'll be much better for your voice to avoid tension in the upper body or anywhere in the body as well. And just being really mindful of your routine. So in a few weeks' time, I've actually got a yoga practice for reflux. Again, we'll be connecting to the breath to try and activate that calming parasympathetic nervous system. It'll also allow you to move and flow without doing a yoga practice where your mouth, your heart is over the stomach. Of course, in forward folds, downward dogs, it's likely that that might make reflux worse. And then it won't go heavy on core at all. So it'll just be a nice bit of flow and movement that might help you if you are suffering from reflux. So keep an eye out for that. So I hope you found today's video useful. Please, if you've got any questions, as I said, I've been through all of these tests. I've taken all these types of medication, just drop me a line. As I said, I'm not a doctor, but I am a certified vocal health first aider, and I've got quite a lot of experience in this area. So thanks for watching. If you want to find out more about the relationship between the body and the voice, then hit subscribe. Thanks again, and hope to see you again soon.